Hi, I'm Casey with QuickCaffeine101.com, and today's question is, what is caffeine withdrawal syndrome? For the new edition of the Diagnostic and Statistical Manual of Mental Disorders, one of the new additions that may be included is caffeine withdrawal syndrome. The emphasis on caffeine has been a result of new studies which examine the effects of caffeine on the body and the mind. Some psychologists believe that the dependence on caffeine is similar in form to that of alcohol and drugs. Caffeine withdrawal syndrome is a topic that is under intense debate, and many discussions between psychologists have only fueled more interest in the subject. The essence of caffeine withdrawal syndrome is centered on those whose bodies are so used to the caffeine that the sudden lack of it in their systems can affect their sleep, their work, and their active life. It supposedly affects all the decisions they make and their performance during the day as well. The effect of caffeine withdrawal syndrome is so pronounced that it would actually qualify under the same scope as those who suffer from drug or alcohol withdrawal. The evidence supporting caffeine withdrawal syndrome has focused on the increased visits to emergency rooms of people who consume heavy amounts of energy drinks which contain high amounts of caffeine. Herbal drinks and those carrying sugar also present that as well. There is certainly a health threat present when these energy drinks are combined with alcohol or drug use. There are a number of symptoms associated with caffeine withdrawal syndrome, and these include everything from depressed moods, drowsiness, headaches, irritability, lack of concentration, muscle pain, nausea, and vomiting, just to name a few. While there is a consensus among physicians that there are withdrawal symptoms associated with the lack of caffeine, the debate is whether the seriousness of these symptoms warrants the status of having caffeine abuse disorder included in the same context as alcohol or drug use. There have certainly been a number of issues that have called into question whether caffeine withdrawal syndrome also deserve that type of standing as well. It has been noted that many people who use caffeine on a regular basis and then stop do not even suffer any symptoms at all. One recent study, however, concluded that upwards of 70% of people have suffered in some form of withdrawal symptoms after cutting back on caffeinated drinks. It appears that the symptoms vary depending on the person. However, a more relevant observation is that there may not be enough evidence collected about the addiction to caffeine to warrant elevating the status of withdrawal syndrome as of this time. One important observation is that those who suffer from alcohol or drug withdrawals because of their addiction often seek out another type of addiction to take its place. With caffeine withdrawal syndrome, the effects, although noticeable, may not be as strong enough to cause most people suffering from them the desire to seek out other forms of addiction to take its place. A conclusion that many doctors agree to is that those who want to quit their consumption of caffeine should cut back slowly and not all at once in order to avoid the symptoms of caffeine withdrawal syndrome. If you are thinking about quitting caffeine, consider using QuitCaf. It's an all-natural dietary supplement that minimizes withdrawal, fatigue, and irritability, allowing you to comfortably quit caffeine within just 10 days. It's guaranteed or 110% money back. Just go to QuickCaffeine101.com and don't forget about the 20% off discount code in the description box below this video.